Good evening, everyone. My name is Dr. Pfleger. It's a pleasure and honor to be speaking with you today on this recording, especially because it is my 3-year anniversary. Daniel, our wonderful leader at Black Mental Health Matters, asked me to just talk about a specific topic this evening to celebrate my 3-year anniversary with Black Mental Health Matters. If anyone doesn't know a little bit about my background, I am an IO psychologist. I work in the space of human resources and studying work behaviors. I'm also studying to become an educator in that space as well, and working on my executive MBA, and also finishing up a couple of master's degrees behind that. So really excited to be in this space. But I wanted to talk about this evening was to specifically talk about the Supreme Court ruling that did happen. I want to take the opportunity to tell everyone that I am very disappointed and disheartened about that ruling. The path to education, especially college and higher education, just became a disadvantage to serving our youth. And it's got a lot harder now that the Supreme Court has taken a step back, I believe, in stopping affirmative action. Everyone should have the chance to go to a good college, and we all deserve that. And it's just really disappointing that there's not a fair chance for those now, because colleges can be more discriminatory in how their processes are and not follow an affirmative action program. And it is disappointing that all over the U.S. now, we now face more challenges around this area of equality in terms of education, especially at the collegiate higher level. So I just want to take the opportunity to speak to my colleagues in the education space to say that I hear you, I'm with you, and I am disappointed as well. It is far greater disadvantage that we now have to face together. And I just want to tell people to harness on to the values and the fairness of education. We must do this together. And so I am disappointed, but we'll talk today in my recording to talk more about this in a way that I feel will honor and the moment of my being able to speak with you about a mental health topic and commemorate my anniversary here at Black Mental Health Matters. So I wanted to talk about Black Mental Health Matters topic today would be mental health and with college students. I think that's fitting about this topic is because it encompasses not just the mental health of youth, but also adults, young adults, students K through 12, and it also will encompass burnout for educators as well. So just to begin about a little bit more about why this is important to me is I am a lifetime learner, I mentioned that, but also I think it is important that we support students in their mental health. I myself as a mother and a wife have 2 children right now who are now in college. And so I know the impact that it does have on families and on students from a personal and a professional level. Societal and personal and economic stressors are something that is going to happen to everyone, but especially impacted, I feel, when COVID hit and the mental health of students and staff became a real important topic to talk about when we talk about mental health. And this impacted what I call a student mental health crisis and called to action many schools and communities to address this head on. It's a tragedy for me to think about this in a way that a public health crisis is never just a crisis that happens in one area, but it happens across just the nation and countries. Mental health is challenging for children, adolescents, young adults, and this is real. This is widespread. And it's important that we recognize this because it is treatable and it's often preventable, but it has to be talked about more. And as an educator, as a mother, this is a real topic that I wanted to kind of just talk about today to address youth mental health, but especially college students and their mental health. The student crisis is something that needs to be addressed with educators and schools. The well-being of students are so important these days. The rate of suicide is so high, and I think it's really important that we start to address and combat what's happening in our schools and what's happening with our students and what's happening in our homes to support students and youth. So one of the things I wanted to talk about is how do we create and strengthen school cultures and make them more positive and more affirming when you set foot on the campus or at any place that you are attending college. I think one is important that we develop and enforce anti-bullying policies. We need to train staff about prevention, about bystander interventions. We need to talk to students and families about mental health. We start to use inclusive language and behavior. We need to be more direct about that conversation and more intentional. And we need to really implement what's feasible with structural changes that happen in the start of this day with any student, and talk about the benefit that students have in mental health. And I really think it's really important because I talk about things in a way that we can move forward with and come up with solutions. Is that we need to expand on social emotional learning programs. As an educator, I think that is a key to navigate some of the things that we see in our schools and some of our broken systems. And I felt like we need to recognize signs of trauma and behavior that we can help students take action. As an educator myself, I know the first thing I notice about students' behavior is I look for signs of behaviors of a student struggling with mental health. Could be things happening at home. And making sure that I am in the moment to help provide support and guidance and mentorship. We have a lot of wonderful programs in the Chicagoland area, but also there's a lot of opportunity here to talk more about how we can provide mental health support for our students. And so I think that is one of the things I wanted to just bring to forefront. There's a wonderful program that the Surgeon General here in the United States has started, which is called AWARE. It's Advancing Wellness, Resilience, and Education program. It's funded by many schools, and they practice mental health screening, early intervention, prevention, and treatment. And I just want to lift that up as a resource, especially in the United States. But across the African diaspora, I also want to just talk to those colleagues as well. It is important that we lift up the voices of our students, that we are the mentors, that we are the leaders that they see, and we support them as best we can. And so I want to just lift those educators out there who are across the diaspora to talk about how we can help protect and prioritize the higher risk students that we see, who are living in troubled homes, who have disabilities. And so I wanted to talk about that today. In closing, I'd like to say that there's many solutions that can be discussed, and we do a lot of discussion, but there's a limited action and resources in many areas. And so I think it is our duty to make sure that we are talking about this in a way that's intentional, but having action behind it. So I wanted to thank you all for having me do this wonderful topic today on college students and mental health. And those educators out there, I want to just thank you all for all that you do. Is because I know the work of being an educator is difficult at times and challenging, and the landscape has changed over the years. And so I want to just lift you up in this moment and say that I am here with you and support you, and hope that I have the opportunity to, again, continue this work. I also want to mention that I have started my own, this will be my third business venture. It's called Pedagogy Pro Plus. It's a higher education consulting firm that I'm starting, and I'm really excited about working with consultants in that area of higher education. So I wanted to close this recording podcast to say that I really have appreciated my time and continue to work with Daniel and the rest of the board and Dr. Kevin Washington, our current president. I have been honored to be the vice president for over a year and a half now, and also the director of research here at Black Mental Health Matters. And I just want to thank everyone for being a volunteer, for coming in and supporting the organization. We do now have ways to support the organization. So please check out our website, and that will give you some more incentive to maybe join as a volunteer. We are looking for more volunteers. I'm always looking for wonderful research topics to add to the content. And so we're so excited about the many things that we have in store for the many, many years. I hope Black Mental Health Matters will stay in place to help support the African diaspora and those in the Black and Brown community. I want to thank you so much for this opportunity. Have a great evening, and thank you again.